Morning. Hello everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Human movement diagnoses hypoflexible and asymmetrical iliopsoas length. If this musculature is restricted or tight, it'll definitely be a cause to low back pain. How do we mobilize and release these structures? With the large self-care mobility tool, I can find my pelvis and sink the ball in the pelvis to push on that direction. In the morning, I often dynamically release mine with rolling and active release, where I squeeze my buttock and extend my hip and work my hip to the side. You can also add rotation. Next, I'm rolling so the ball's towards the belly button. So I'm between the belly button and the front hip bone, not down in the groin, but the ball is pushing towards the center of my body. This helps us get psoas minor and major. We also want to do more time on the more restricted, tighter side. So if my right's tighter, I might spend 2, 3, 4 minutes on the right, where I spend 1 to 2 minutes on the left. After I bring blood to the muscle, I am now better able to stretch it. So when I go into a cobra pose or a prone press up, I can breathe in and relax and let the pelvis sag down to stretch the iliopsoas. This can also be done in standing. Again, if one side's tighter than the other, you can shift in your body to find the more restricted side and spend a little bit more time on that side. A more active way to release psoas is called the world's greatest stretch. Dynamic, before activity, I'm rocking forward and back, flexing and extending the hip and knee, squeezing the buttock and the quad, bringing pelvis to the ground. Here I feel a stretch through the front of my hip, across my groin, and into my pelvis. I can also add full body movements to hit different angles in the spine and pelvis. The side that's more restricted, you would spend more time with it down, with that leg back. So maybe 2 times to 3 times on the tighter and 1 to 2 times on the less tight, but both would need this. This concludes our video on psoas mobilization and release. Thank you.